Our first afternoon panel will be led by Laura Hernandez Gold, who will share information on Tier 2 in-school mental health supports and services. She will introduce panelists from across the state who have effectively implemented school mental health and suicide prevention programs. Please use the Q&A feature that is at the bottom of your Zoom window to pose questions for Laura and the panelists as they present their valuable information.
Thank you, Rohana. Good afternoon, everybody. Before we get started, I would just like to say another round of applause for all the presenters that we have had this morning and yesterday. It has been a phenomenal summit so far. So we know we have big shoes to fill, but I think we will with our panelists today. So the National Center for School Mental Health defines Tier 2 school mental health services as supports for students who have been identified through a systematic, equitable process as experiencing mild distress, mildly impaired functioning, or as at risk for a given problem or concern. Examples of early intervention include small group interventions for students with similar needs, brief individualized interventions, mentoring, and/or low-intensity classroom-based supports. Our panelists today represent rural school districts who have built strong partnerships with their community members to provide effective Tier 2 school mental health supports for their students. We hope that you are able to take home a few nuggets of inspiration on how rural school districts can effectively implement school mental health services, how implementing a peer-led suicide prevention program can help students stay safe and connected, and how defining specific protocols and procedures for effective suicide care can help the whole community. All right, so now to share our panelists today. Our first group of panelists are Dr. Nadia Moreno and Angel Espinosa from Alice ISD, and Dr. Crystal Garcia from Texas A&M University, Kingsville. Alice ISD received funding under the School Climate Transformation Grants from the U.S. Department of Education in 2019. Their program focuses on utilizing a holistic practice to incorporate mental health services and safety prevention measures to help create a safe and healthier school environment. The School Climate Transformation Grants Initiative builds on the development and testing of evidence-based multi-tier decision-making frameworks, such as positive behavioral interventions and supports, or PBIS. Next, we have Casey Holder and Kaylee from Mansfield ISD and Christy Wiley from the Jordan Elizabeth Harris Foundation. Hope Squad started in Mansfield ISD 3 years ago with their 8 middle school campuses and is now also in all 7 of their high schools. Ms. Holder was one of the first Hope Squad advisors, and during last school year, she was able to train all the staff at the high school campuses on QPR, question, persuade, and refer, prior to implementing the Hope Squad program. Hope Squad is a peer-to-peer suicide prevention program which aims to create a safe school environment, promote connectedness, support anti-bullying, encourage mental wellness, reduce mental health stigma, and prevent substance misuse. Hope Squad members are trained to be aware of their peers and watch for warning signs. They learn to show empathy to their peers, listen without judgment, and how to connect them to trusted adults. Finally, we have Amy Smeldelka from Dickinson ISD, Diane Manley from Gulf Coast Center, and Dr. Lakeisha Kearney from Region 4 Education Service Center. Dickinson ISD receives support to implement the Texas Advancing Suicide Safer Schools Roadmap by attending a workshop and learning collaborative funded as part of the Resilient Youth Safer Environments Substance Abuse and Mental Health Services Grant. The roadmap provides public health information based on best practices for suicide prevention, intervention, and postvention, and is intended to be used as a planning guide by Texas school districts. So that is our wonderful esteemed group of panelists, and I'm going to start the questions here. And the first question will be to everyone here to please share an example of how the collaboration between your school district and your community partner has enhanced or improved services for the children and families you serve. And I would like if Alice ISD could start off.
Hi, good afternoon, everyone. Okay, with this question, I'm going to go ahead and have Crystal, Dr. Garcia, start off with this question.
Thank you very much, Dr. Moreno. And thank you to everyone participating in this awesome summit today. So I am the BSW Field Education Director for the Social Work Program at Texas A&M University in Kingsville. And one thing that I'd like to highlight in how Alice ISD collaborates with their community partners is we are one of them. Our program trains social work professionals in the South Texas district. And so we partner with Alice ISD to get our social work interns to do their placements at Alice ISD. And it's been a great experience. In fact, we have Angel Espinosa, who's also from Alice ISD, he used to be a former student years ago, but now he's working and doing awesome things in their district. So that's one way that we collaborate with Alice ISD, and we continue to do that and giving our students that hands-on training that they need in the communities where they live and where they're going to be working.
And if I could just kind of expand a little bit on that, through this collaboration, we've been able to, we have 9 school social workers in our district. We have at least one on every campus here in Alice ISD. So through this collaboration with the university in Kingsville, our interns were able to kind of train them in our processes and our policies, and we were able to hire people so that we can offer these services to our students. Back in 2016, when I started, there was 2 of us for all these students, and through our collaboration, we've been able to build this program to what it is today with the help of people like, Dr. Garcia and especially Dr. Moreno.
Thank you, Alice ISD. Dickinson ISD?
Hi, thanks for having us today. Dickinson ISD, we partner with the Gulf Coast Center, and we work very closely for our suicide prevention procedures. We are very open communication, and through our collaboration, we have removed barriers. We have strengthened our access to supports and services for our students in our community. And we've also increased our training for our staff, especially our counseling team.
Oh, sorry, Diane or Dr. Kearney?
I will say Dickinson has done a fabulous job in working at the Education Service Center. Our role in how we support school districts is really serving as the connector, connecting our school districts to all of these resources and agencies. Many times our agencies want a contact in the districts and they may not have that person. So reaching out to the Service Center and our partnership with RISE, we were able to connect with the fabulous Amy and Dickinson ISD and several of our other Galveston County school districts so they can actually attend the training, participate in building up their roadmap for suicide prevention, intervention, and intervention.
And as the local mental health authority, I'll just add that we work closely with Dickinson through our crisis hotline and support that way. And so having that connection and where we can just call each other up and say, hey, we have a student who is in crisis and needs some support. Here's what we see is happening, and just communicating back and forth if something doesn't go as planned, getting some feedback and making those changes. I think that's been one way that we've really been able to support each other.
Thank you. And Mansfield ISD.
So with our partnership with the Jordan Elizabeth Harris Foundation, we have been able to bring Hope Squads to our middle school and high school campuses, like you mentioned before. We are currently in the process of we've written a grant, and so we're waiting to get that to implement at our intermediates as well. And so it is really starting to change the culture and climate of our campuses. Really fostering that connection piece and inclusivity. Also with our partnership, I've been able to become a QPR trainer. And so, like you mentioned before, not only have we trained our high school staff members, but I've been able to train our transportation staff and our student nutrition staff. And now I'm partnering with our Title I campuses to meet with the families in our parent engagement nights. So really getting the word out there and breaking down that stigma that's tied to suicide and mental health.
And then my name is Christy Wiley. I'm the program director for the Jordan Elizabeth Harris Foundation. And we are a nonprofit that does suicide prevention around North Texas, so Tarrant County and the surrounding rural counties. And because we know suicide prevention is an unfunded mandate, we are 100% donor funded. And then we turn around and provide this extra support and funding to do QPR and to implement the Hope Squad program. So I am a Hope Squad master trainer as well. We support 120 schools across 20 districts. And Mansfield ISD, they're just some of our rock stars. And here with us today, we also have a Hope Squad student, Kaylee, who is amazing. We just know that schools need support with these programs. You know, if I'm trying to lose weight, whether I do Weight Watchers or keto or paleo, if it's done with fidelity, it will work. And we know that Hope Squad is one of those programs that works. So our foundation, our nonprofit, is really invested in the support of this program to make sure of its longevity and fidelity.
Thank you, Christy. I didn't know if Kaylee had anything to add to what Casey had said.
Yeah, as a Hope Squad member, I feel like it's extremely important that we keep this sort of thing like alive almost. We keep pushing it and we keep implementing it in our schools, especially with younger students, because then as they grow, it goes with us. Mm-hmm. And so I think it's just a wonderful thing that we're all here and we're all supporting this.
Thank you, Kaylee. All right. So for our second question here is, can you provide, or if you please provide an example of a challenge that you may have experienced in developing the partnership and how you work to overcome that? And I'd like for maybe Dickinson ISD to start this question.
So I think the only challenge, and maybe not, I wouldn't even call it a challenge, is in the beginning, we were just learning and meeting each other and figuring out how to service our students, but we built a big, close relationship. So we talk on a regular basis, we email on a regular basis, text, and we have open communication. So if there's a situation with a student that maybe did not go exactly how we had pictured it, we learn from that and we talk openly all the time on how we can strengthen that. And then we take those lessons, we debrief with our counseling team and our mental health teams on each campus to make them grow. And we're just very open, and we meet with Gulf Coast Center and Region 4 all the time so that we can grow and strengthen from what we've learned. And through that, we build training. So when we have new staff, our new counseling team, new principals, APs, we take those lessons and we teach our new staff members that. So every year we grow and make sure everybody's on the same page. Because I think in the beginning, we were putting great things in place, but not everybody was on the same page. And so we've learned from that. And so we just make a point to debrief every counseling meeting with our partnership and how we can grow and where are our trends, where are we lacking, and then grow from that. And then I talk to Diane all the time about, hey, can we look at this? Can we do that? So I think challenge in the beginning was not sharing enough or communicating enough. And now we overshare, but it's very helpful for our students.
That is really, that's really important. I love how you put in the whole idea of debriefing also after everyone, because we can be trained and we can have all this information. That doesn't mean that we don't need to still go back and see, what did we do really well? What did we need to work on? And how can we bridge those partnerships closer? Diane or Dr. Kearney, did you have anything to add?
Amy covered it really well, and we're so thankful to be able to work with Dickinson because they give us great feedback and they give us a lot of, assessments and information about their campus needs so that we can kind of help go from there. One thing that we see, not necessarily with Dickinson, but just in general, is, you have all this great information that can live with a person or a specific role that someone has. And if they change, their position, if they leave the district, a lot of times that information and that history can leave with them. So, through some of our coalition work, we really try to be transparent about what we're doing, what's working well. Amy and Dickinson share their policies and procedures and a lot of things, that other folks can take and learn from and modify to fit their needs. So just making sure that we don't have those silos of information, that can be a challenge, making sure that it's shared, widely with everyone.
Diane, can you just I'm sorry, Christy. Can you just briefly tell everybody here, when you say coalition, what are you referring to?
Sure. So we have a Galveston County Suicide Prevention Coalition that is made up of all different, agencies, school districts, social service folks, that we come together monthly and share resources. We share different training opportunities. We have guest speakers. So just making sure, again, that people know what's out there and available, what's going on, and people can share their needs or things that are going well at those meetings. And then Amy and I are also involved in just different, networking opportunities like the Galveston County CRCG, the Community Resource Coordination Groups, and things like that. So there's all different ways that we come together to talk about what we're doing.
Thank you. Christy?
I was just going to say that our biggest issue is time. So it's finding time to do all these great things that we know will save student lives. So one of the things that we really emphasize when we're implementing Hope Squad or we're doing QPR is we go in and we say, we all know suicide's the second leading cause of death for ages 10 to 24 here in Texas. So unfortunately, it's not a matter of if, it's a matter of when a student is in crisis. So what we know is that a school district, a campus, is going to spend time on suicide. But do we want to spend time on suicide prevention or suicide postvention? So where do we want these resources to come in and wrap around our students? And, when we're implementing a Hope Squad program, a Hope Squad is not a club. It is not a leadership group. These are kids that are nominated by their peers to be part of the district or the campus's suicide prevention plan. So, while time is always an issue, we've got to find the right time to put in the work.
I couldn't agree with you more, Christy, especially when we're talking about suicide and suicide prevention, intervention, and postvention. Casey, Kaylee, or Dr. Kearney?
Sure. I just wanted to jump in and say, similar to what Amy and Christy have said, so staff turnover and time. Yes. One of the biggest ways to kind of overcome those challenges is really through consistent coaching. So in order to make sure that it's not a one-stop shop, training is only done at the beginning of the year and done, in order to build, like Diane said, build down those silos, is to really have that coaching component. And I think the Texas Suicide Prevention Collaborative really does that with our cohort. They continue to coach them, working with Gulf Coast. They continue to have that feedback circle. So I think that is a big way to overcome that kind of a challenge.
And I'm gonna just piggyback what you all have said about the time and the turnover. That at the district level is something that I have struggled with. And we rolled it out in the springtime at every campus. And so it was hard to get the ground running before we were out for the summer. And so Christy and I kind of talk about how it takes the Hope Squad program about 3 or 4 years to really start rocking and rolling on its own. And so that's been a little bit of a challenge, is the staff turnover and the time piece. And I wanted to ask what Kaylee sees as a kiddo on the campus, some challenges that she's faced.
For me, the biggest challenge I've seen is parents mostly being worried that it's too much for a kid to handle. And I understand where they're coming from. I really do, because emotions, especially just growing up, they're hard enough already. And when you add people on top, like, it's okay, you can tell us. Sometimes you feel like you can't. And I understand that. I've been there. I was there. And so a lot of times parents are thinking it's going to be too much for my child. It's going to make them suicidal, and suicide, that's not how that works. And so I think that's the challenge I think is the biggest, because it's constant. And no matter how many times we'll tell you that it's going to be okay, like, it's back and forth a lot with parents.
That makes perfect sense. I'm a parent and I can understand that, but I also do suicide prevention at the state level. And I just know how so valuable it is, important to let everyone know what they can do and how they can help everybody. Alice ISD.
I think one of the challenges that we face here when it comes to mental health is the lack of services that are in the area. Angel and I were talking about this not too long ago. You know, it's almost as if we're always having to think outside of the box. So what we've done is through our grant, through the School Climate Transformation Grant, we have brought in mental telehealth therapy services. So our students have that. If they're in need, we can provide services up to 10 sessions for our students. However, if the therapist feels that there's a need for more, then we can definitely work with that. We've also been able to include families within these services, and also staff members who are in need. So we're constantly having to think outside of the box to be able to provide mental health services within our school district.
And I'd like to piggyback too on what Dr. Moreno is talking about here. So we know that, you know, when we're talking about mental health and preparing the professional world to address the growing needs of our school districts, of our families and children and adolescents who we work with, it really extends beyond direct practice. You know, it starts at how are we training professionals? How are we preparing them? And from a higher education perspective, you know, I've recently done some research that supports the fact that we need to be looking at our own curriculum in higher education and preparing social workers and psychologists and anyone that's interested in going into the mental health field, because we all know that it's everywhere. You know, mental health, mental illness, all of that is just at the forefront of all that we do now. And another thing too is just learning how to collaborate with other areas, you know, and understanding that we all have these different strengths and skill sets that we can use and really come together and collaborate to provide the best services and support to, you know, our clients, our families, our school districts.
Thank you.
I would also add, sorry, another challenge that I've seen is finding the time to get in front of campuses to train teachers on QPR, just because they are involved in so many other things with curriculum and map testing and different things like that, that it's hard to find time to get in front of all of the staff, even though that's the kind of, I feel like that's my one thing. That's what I'm wanting to do. That's what I'm charged to do. And then also a challenge has been when I do train staff, helping them to not be uncomfortable about the conversation. Because this is our field, this is what we can do and we can talk about it, but teachers, it's a little uncomfortable for them. And so working through that and role playing those with the teachers and just getting them to understand that we are all here to save lives, every single one of us. And so working through that barrier with our staff, because it's different for some of them.
Definitely, definitely. I completely agree. There's fear there. I believe that everyone in our schools want to help their students and want them to be successful and succeed and thrive. But there are certain aspects when it comes to mental health that can be very fearful. Angel?
So just going off, I think we can all kind of agree to that these are some of the obstacles and barriers that we're all seeing across the board, and going off of what Dr. Moreno was saying about LSISD, we had to get very creative, being from a rural area. So, putting on our own parental education community sessions, and that's another barrier, not even with community partnerships is, getting parents to show up, but I think that could be a whole different panel and topic, but it's having to create these kinds of things and be creative, thinking outside the box when we don't have the resources in the area. So it's almost like having to create, these resources. So like I said, like doing our own community support sessions, in the evenings. I'm hoping that parents show up, and I say even if one parent shows up, we've won. And so I think that's it's just kind of I think we're all experiencing the same types of obstacles and barriers.
I definitely agree. And I think you all brought up some big areas that we all think about as challenges: time, ability to meet with our families and our parents, and getting over the fear of talking about mental health, because we should be talking about mental health just like we do with physical health. Being able to debrief and really work and train our staff in knowing how to respond to mental health crises. And what I have found wonderful throughout this summit is that we've been showing how the small rural school districts can make this happen. Sometimes it is inventing something and it's really looking at it from a really intense perspective on how can we bring this, but then there are other ways through grants and other forms that you can bring in, like you said, the telehealth, which is so very valuable. We saw that when COVID hit and the pandemic happened, how extremely valuable having an additional way of providing services to people was during that time and still is. So I think those are definitely some of those major challenges that everybody's facing. And I'm grateful for you all sharing the ways that you have tried to overcome some of those. Our next question is going to be, how do the students and the families inform the work that you're doing? So the family and youth voice, how do you see that? And I'm going to let Mansfield start this one. I think they're going to have a good answer for that.
Yes. Okay. So, oh geez, so many ideas. Okay. So with family and youth, joining in the suicide prevention program and the Hope Squad program, it brings sort of an entire new beginning with it, because it shows you that no matter the age range, no matter how old you are, no matter how young you are, no matter who you live with, there's somebody there for you. There's somebody that's going to understand what you're going through, somebody that's going to be there to help you with what you're going through, no matter their age. If I wanted to talk to somebody, I could talk to somebody older, I could talk to somebody younger, I could talk to somebody my age, because they're going to be there. And I think that's something that's amazing for us to have, because it's not just teenagers that experience suicidal thoughts and actions. Kids as young as 12 years old have these thoughts. Kids not kids, adults, veterans, they all have these thoughts. And so when we expand our horizon, when we expand our group of people, that's more lives we can save. And so I think it's really important that we're all collaborating on this together.
That's wonderful, Kaylee. Casey?
Thank you.
I would say, with the Hope Squads, it is peer-to-peer driven. We like the advisors to take a step back and let the kids run with the show, because stuff we think is cool is not cool. And so, and we really want the students to be invested and take ownership in their Hope Squad, and really foster that connection within one another, to then spread it out to the community.
Christy?
So the thing about Hope Squad, so again, they're nominated by their peers. This isn't something that a teacher or the counselors or the principal gets to choose. You know, every student gets a QR code that says name 3 of your peers that you would go to if you were struggling or in a crisis. And the same names rise up to the top. So when you look at the different demographics of your school, you create this Hope Squad that have all those peer groups represented. And then because we know that teenagers and kids talk to kids before they will talk to an adult, we're doing this specialized training so they know, does this friend just need to talk to somebody, or does this friend need to talk to Miss Holder or go see the counselor? And that training for the whole staff, for transportation services, cafeteria services, is you never know at which circle that student or that person will hear the thing that that kid says. But if we can start to change the culture, the student-led charge of it's okay to not be okay, let's go talk to a trusted adult, and we remove that stigma, that's where we start to see a culture change. And the whole school starts to take care of each other, because we know we're not going to let anyone slip through the cracks. And that student voice, again, they know what their peers will respond to. So we really want them to take the lead and let us know, okay, what do you think? How do you think we can help y'all? And by listening to them, that informs, you know, what is cool or what they'll really respond to.
Thank you, Christy. Alice ISD?
Yeah, so I think all of our positions here, I think I can speak for all of us, say that we kind of find the cracks and we fill them, you know, either that's going out into the community, you know, doing home visits, visiting kids, you know, our students' homes, our families' home, kind of figuring out not just, okay, the kid comes to school, what's going on here, but what's going on in the community, using that for our needs assessment, and continuously doing a needs assessment throughout the whole school year. You know, parent surveys, student surveys, using the data demographics to kind of inform the practices, the direct practices that we're providing to our students and families, because you don't want to implement something that's really, you know, not affecting your specific community, you know. But even again, just kind of going off what the last speaker said, is like getting the students involved, you know, taking a scroll through even TikTok and figuring out what, like, hey, like, what does this word mean? And asking the kids, like, you know, in sessions, like, hey, like, I heard this word, what is it? Because the lingo has just gotten, you know, so diverse with social media. So it's, you know, getting these kids involved so that we know that, okay, hey, this is a trigger word, you know, it may not sound as bad, but hey, this is a trigger word, so that we're all, our staff and the community is kind of aware of what's going on.
Yeah, and just Angel, we found that our kids told us if people are using the pill emoji in their texts, we've learned that they're more likely to be to have a higher acuity as far as a suicidal crisis. So this is the stuff that can keep us, you know, if we'll just ask the teenagers, what do we need to know? They'll tell us. And those are the little things that could help save a life. You know, you're exactly right.
Another thing that we have here at Alice ISD that has helped so much is we have a monitoring system for our student issued email and Google accounts. So if a student writes something that references suicide, and it doesn't even have to say I'm going to kill myself or I'm having thoughts, or it could just lead up to it and we get notified, and then immediately we have a social worker or a counselor meet with our students, and then we do an outreach to parents also. So we're just we're constantly trying to educate our students, our community, our faculty about the importance and really the need to educate everyone about suicide.
And I think also, just real briefly, like we've also had to work to kind of reduce the stigma, not only of mental health, but of the word social worker. You know, when we hear the word social worker, it's automatically, oh, you're CPS, why are you here at my house? You know, why are you meeting with my kids? So we really have to kind of turn the tide. And now, you know, our community kind of sees us as that asset and that resource. So again, being able to get out in the community and, you know, talking to our stakeholders, you know, has really been able to inform our practice and how we go about providing direct and indirect services to our families.
Definitely, Angel. Dickinson?
So the same, I think I allow time at our counseling meetings to have that debriefing, and we learn so much from each other. It's great for the high school counselors to share the language and the TikTok, all the things, and our elementary counselors are learning about it. And we use that conversation to put our guidance lessons in place so we can put that prevention piece in place. So we look at the trends and we track, we use Skyward. And so in our guidance tab, we track our interactions with students. So we pull that data too. So I'm able to be data focused on our prevention side as well and our postvention. And with our partnership with Gulf Coast Center, if we do have a student that's in crisis, they do follow-up care with the family. So we're able to learn from the families as well as what went well, what was helpful, which students are going to be receiving services outside, which do we need to provide more services from the campus. So I think that collaboration as well and that follow-up care on the crisis side has been very helpful. And that really informs and drives us to make changes and be more on the prevention side.
I will add to that data piece and kind of going back to what your AWARE panel said yesterday and making the connections with using universal screeners, using that school climate data. That's all data that can really inform where you want to target your interventions and supports. For our purposes with RISE, we really use the Health and Human Services data that indicated that suicide was a need in Galveston County. So expanding your options to where you look for data, and not just always thinking about the same ways to gather and collect data, but expanding where you could find data to really inform how you want to target your supports and services for this students and families.
Thank you, Dr. Kearney. I definitely agree. And we've been talking about that throughout the summit. And like you said, bringing up the Project Aware panel group, data is very, very important. And sometimes I know as a social worker, I don't always think about the data. We're thinking about, okay, how are we going to help the student, their family, or maybe it's a staff member or someone else, you know, but it is so very vital for us to look at that to see if we are making an impact and making a difference. Diane, did you have anything to add to that?
I feel like everybody's covered it, but I know for us as the local mental health authority, being a part of the SHAC meetings is helpful so that we can kind of hear firsthand, you know, what's going on. And we just appreciate, you know, being able to sit in on those. And Dickinson invites us, Santa Fe also includes us in some of the other local school districts. So that's helpful for us again, so we can see what's going on and what the trends are and see how we can maybe fit in to provide some support.
I think it's wonderful. I think a lot of what I'm hearing is that connections, education, support. I like the way Kaylee said it, you know, we are all there for each other. And it is okay to not be okay. And we know that our kids are talking about this. They are so ready to talk about it. It's usually our adults that are just so fearful of saying anything. And once we can get over that, about that fear and really educate, we really can make a huge difference with the connections that we have throughout our community. I'm sure we have a couple of community partners here with our school districts, but I'm sure there are many other partners in your community that you have gone together and drawn together and become, you know, a strong group for your students. And so I think that that's just so vital that we talk about that, even though we may say we don't always have the time, it's so very important to make that time, right? To really even if it's cutting into something, we know that that's going to make a difference in the long run, because all of what you're talking about isn't going to happen overnight. It is definitely a process. The grant, the funding from a foundation, the training, you know, whatever the case may be, that's going to be a process that's going to take a while. I have another question for everybody, and I would like to ask, if you had a magic wand, or if I did, what are 2 or 3 things that you would make happen to better support not only students' mental well-being, but your staff as well and their families? So I'm going to open that up to anybody here to start out with.
I would like unlimited funding. I would like more staff. And I would also, and I don't want this to sound mean or anything, I would like to where we, and I definitely respect parent consent, but sometimes that's a hiccup in getting follow-up care. So I would like to have a bypass or something that students really need follow-up care, that we can make sure that they're followed. But money would be very helpful.
Funding as always.
I would say I would just reduce the stigma behind mental health. I think because that's one of the biggest challenges for people receiving mental health services is the stigma behind it, especially in a rural area. I mean, we've had situations where families don't want to seek counseling in the same city because they're afraid that somebody's going to see them there. So just reducing the stigma, I wish we could really make that happen. And then of course, unlimited funding, as always. Again, we're very fortunate here to have a social worker on every campus, which is pretty unheard of in rural areas. You know, we have 4 of us that are funded through grants. However, the other 5 are not, they're district funded. So I'm a huge advocate for school social work, and I always tell school districts that find the funding to hire a school social worker, because in the end, they help reduce dropouts. They help increase the attendance. So in the end, it really does pay for itself. So just always, you know, thinking that way when it comes to school social work. But of course, unlimited funding would be amazing to have. Yes. And then I would love to have more social workers and counselors on the campuses, because I know that, you know, with our counselors, they have such a high student to counselor ratio, you know, and so being able to lower that would be amazing.
Definitely.
I would like, and this is not at the school level, but our district has done some really amazing things these past couple years, in addition to Hope Squad, for our community and our families. We partner with an outside vendor that does the legwork for finding therapy for our families. But the problem is the wait right now to get into somebody is horrible. And so like we and that's nothing we can control. But if I had a magic wand, I would have more access to proper care, mental health care. What about you?
I'm just going to expand a little bit on one thing we've already said, which is more counselors. I think my high school has maybe 5 counselors. 6. We have 6 counselors, and there's, I don't even know how many kids, way too many. I think I've met my counselor once. And I've been there, I'm already a sophomore, and I've only met her once. I don't even remember her name. I feel so bad about that. But if I had a magic wand, I would definitely increase the amount of counselors on every school, because so many students want that help and don't have the chance to get that help. So many students are like, yes, I would talk to somebody about this, but I don't have the time, and they don't have the time. And when they don't have the time, it makes you feel like you're not worth that time. And you are.
I think, and one other thing I would, if I had a magic wand, is to be able to train every parent in the community on, if you see this, call somebody. I'm fortunate enough that some of my counselors know me very well, and they'll call me at home and I will call and get that kiddo some help. But that if a parent sees something, that they then know what to do. And we have a reporting tool in our district that's amazing for that. We just need to let the families know it's not just, I mean, mental health is part of it. We need to be able, if you see something or your kid tells you something, tell someone. So.
And I think what you're speaking to, Casey, there kind of references both what Amy said and Dr. Moreno, decreasing the stigma, but also it would help then with more parents saying, yes, I want to get the help for my student. Here's my permission. I'll sign the release that you need. Let's work together on how to do this. And so there wouldn't be such a challenge there with parents sometimes being so fearful for so many reasons about that. And so I think that's the piece, right? It's that education, it's that pushing out of that into the entire community, letting people know that it's okay not to be okay, letting them know that there is help. And yes, we have too few counselors, we have too few social workers, and we have too few clinicians everywhere. But I think that the more that we can educate and train our communities, our teachers, our parents, then we have more of that support system for our students and for everyone. And that can be a help. We'll never have enough until we have, a counselor for every 5 students, I think, or a social worker for every 5 students. And I don't know when that will happen. But I think definitely what we're talking about is that education, and is that breaking down those stigmas and those barriers. Did anyone else like to say anything about that?
I think that I agree with everybody here as well. And I think if I had a magic wand, I would put like these mental health professionals, the counselors, social workers in the elementaries, starting from the very bottom all the way up. So by the time that they reach like that middle school, high school age level, they kind of already know, the ins and outs of things and, how it works. We're wanting to work, we mentioned at the very beginning, working on that prevention versus, waiting till it gets too expensive for us to intervene. So, really putting like these mental health professionals, school social workers, school counselors at the elementary, that way that they're able to kind of build those social skills at a very early age.
Definitely.
And can I also say that, while we may not be able to fund more counselors, I know one thing that we really can do, and as example of this summit, and something that Gulf Coast Center does a fabulous job at, is really collaborating and partnering, really working, community agencies helping districts, because our school districts don't have the bodies, they don't have the personnel, but our community agencies do. So creating those partnerships, aligning and speaking the same language, training together, making sure that our agencies understand school language, policies, procedures.
Yes.
And we do that by training together and doing it together. So really building up those partnerships and coalitions. I know Amy has said it, they're very grateful to Gulf Coast. Diane's team is absolutely fantastic. And so really expanding this kind of a partnership with all of our LMHAs in our region is my goal. Working in the service center is to really model this to the rest of our 6 other LMHAs. So that's, if I had a magic wand, I would do that. Not only target for suicide prevention, but based on your data, maybe it's trauma and grief that you build a coalition around. Maybe it's substance use prevention that you build a coalition around. Whatever you need, really building up these partnerships to help.
Dr. Kearney, yes, I completely agree with that, because a lot of times people don't know, right? They don't know what they don't know. And we work in our areas, and then there's an outside group and we don't know exactly what they can provide. I know when I worked on at a school district, not everybody knew what is a LMHA, what is a counseling, community counseling, what does that mean, And it was about educating, but then it was also educating the LMHA, like, this is how the school works. This is what you can do. And this is how you need to work and be together and learn from each other. So definitely those partnerships and collaborations are so very, very vital for everyone, regardless if it's a small rural or a big urban district. The more that we can have that, the better. I know that all of the districts did bring up about a monitoring system that you have. And there was some question in the question Q&A about, does your monitoring system cover for both someone wanting to report a suicide or someone talking about suicide, as well as other types of issues?
Yeah, for Alice, I'm sorry, Dr. Mutter, I know you wanted
That's
to
okay.
talk, but
No,
I'll
no,
kind
go
of
ahead.
jump a little bit. You know, here in Alice ISD, you know, we're scanning the student issued Google emails. We're not only looking for students who are currently having some type of suicidal ideation, but maybe someone that is telling another student like, hey, like I heard you talking about this, you know, we can get help. So it's screening all that, but not only for suicide, but also for violence to self and violence to others, for threats, for bullying. So any of like those key words. And I think the good thing is like when we talked about earlier, how it's kind of the system is also adding like those words. Like we know that teens may be using things like I want to unalive myself versus I want to kill myself. So it's adding those trigger words, and not only for suicide prevention, but also for, you know, for threats, for violence to self and others, or for bullying, possible fights, so that we're able to kind of be up in the brush of things that are going on. So it kind of stands for all trigger words that we can kind of think off the top of our head.
Yeah. And the monitoring system that we used is monitored by people. So they get to read the alert, and then it's categorized in two different ways. We have what's called a QCon, which is it's something that you need to look into within, you know, the next 24 to 48 hours. And then we have something that's called a PSS, and it's set up that you need to respond within 5 minutes. And so we have myself, and then we have 2 other executives that monitor that. And if we don't answer within 5 minutes, it automatically goes to the police department and they will go do a welfare check. So that's the way our district has it set up.
That's great. I don't know if the other 2 districts would like to say anything.
We have a similar system as well, and it notifies campus admin, counselors, and officers or SROs as well. But we also receive a lot of information from our anonymous reporting app as well. We use P3 for that, and for our Google and our online stuff, we use Gaggle. So yes, we receive information that way. And for P3, I get the entire district's responses, so do our officers, and then there's campus teams so that we can react immediately.
We use pretty much the same, hearing when somebody's actually reading it and sending it on to us. But we also have a district initiative called This Is Our House, where people can go onto the website and report there as well. And we're monitoring it there too.
Wonderful. Thank you. Thank you for sharing that. And I know one of the other questions was specific to Hope Squads about how do students know who to go to and you know what they can do. Christy, did you answer that one already?
I did, but after I say this, I want Kaylee to say, so Hope Squad members, because they're nominated by their peers, they're then visible, and they're not just doing suicide prevention. They're doing all sorts of mental health wellness activities in the school. Hope Squad members are bringing the therapy dogs. Maybe one day before a test, they're handing out little lifesavers. One of our Hope Squads, they do something, you know, once a month. They purposely all day don't use their cell phones during passing periods so they can fist bump and dab and do all those things that kids do, you know, so they can make connections with their peers. So because Hope Squad members are visible, this becomes again part of a campus, a district suicide prevention plan, but also mental wellness, school safety.
Thank you.
They're visible and can do all sorts of things. But Kaylee, if you want to talk, how do people know you're a Hope Squad member? Because you're awesome. No, so
thank you. People know I'm a Hope Squad member because I'm at all of the Hope Squad events. I will sit at tables and they'll have our Hope Squad logo on there, and we'll sell some of our shirts that are like, I'm not wearing one of mine today, but it says "You good, bruh" on it. Like, it's very colorful. And people know that I know about it because I've been doing it and I've been out there and I've been showing my support, that they're like, hey, this person knows what they're doing. And I know that I can talk to them if I need to.
Mhm.
And
Mhm.
it's that consistency that I think is really helpful in creating a sense of knowing and a sense of a sense of just knowing who to go to, or knowing the steps you can take to get there.
And remember, these students are nominated by their peers. So most of them already know who they can go to and trust. That's why those names keep popping up. We also have what's called a Hope Week once a year that is dedicated just to foster hope, connection, inclusivity amongst the campus. And we let every Hope Squad on every campus create their own week. So, because again, it's student driven. So we want what works for that campus. I know that some campuses have done like a little video announcing who they are and put that out there. So it's again, every campus is just takes it and runs with it and owns it. So, and we also have some Hope Squad advisors, some teachers that are not necessarily the ones that are right in charge doing all the lessons, but some teachers that students have notated that they are their person, they are their trusted adult. And we have some little stickers that they put on their windows of their classrooms, like this is a safe place. This is because oftentimes, and what I like to tell when I'm training is kids are going to go to their teacher or their friend before they go to the counselor. Half the time when I was a counselor and I wrote a pass for a kid to come to my office, they thought they were in trouble. And so training our teachers to recognize and then modeling with that student, hey, Miss Holder really listens to me when I'm having a bad day. Can I walk with you? And that teacher modeling that behavior speaks volumes to that student. So
Thank you, Casey. And that kind of brings me, we only have a few more minutes, but some of the questions about, before the grants were there for your school, before the foundation funding, was it challenging to talk about mental health, and how did you overcome that? How did you overcome any challenges you might have had with discussing mental health, suicide prevention at the campus level, at the district level, or even in the, excuse me, with families?
Prior to us bringing in Hope Squad, it was really just talked to on an individual basis when our kids were in crisis. And it was really not, we know that there is a concern, but really how to attack that without something in place is difficult. And so really it was more so on that one-on-one individual basis with the student and the counselor, or the student and the administrator, because we're all like a team, but globally and talking about it as a district, it was a challenge. Kaylee, what would you? Out of the mouths of babes.
It was extremely difficult. I remember going through it, and I remember before I was in Hope Squad. So I joined Hope Squad my 8th grade year. So I was in 7th grade when we didn't have it. And it was hard. You could see people struggling, but you didn't know how to help them. You didn't know if you were like almost allowed to help them because you didn't want to get involved. You were scared because you didn't know what to do. And when you don't know what to do, everybody knows what that's like. You get scared. You're scared of failing somebody. And the fact that we are now able to learn how to take these steps and how to help other people, it's becoming such a wonderful place to be.
And it's so amazing. It's getting out there in our community now that we've had it at the middle schools for several years. I've been receiving emails from parents that have witnessed an encounter outside of school, whether it might be at church or a sporting event, where they've witnessed a student utilizing their Hope Squad skills and really helping out. And that is amazing. Our kids are saving lives, and I am so proud of them. It's just, when you hear the community recognizing it and telling you the good things that their kids are doing, that's just, we're doing the right thing here.
Thank you so much. And I know we ran out of time. I know that both the other districts are doing some amazing things, and I'm sure it also took process and a time to really get over and educate. I know how RISE has been so phenomenal in working with the community and getting the education out about mental health. And I know Alice ISD, when I saw them at the Texas School Safety Center, I knew they had to be here because of the amazing work that they were doing there. So I just want to thank all of you for being here, for giving of your time right now, and for sharing your challenges and your rewards and your processes. Thank you, Kaylee, for being here. I think it's so important that we hear from our students so that we know what we can do and what we do to do right by them. So thank you so much. And I'm going to turn it over now back to Rohana.